Integrative Health of Orlando, where I help diabetics every day increase the quality of their life and help them to obtain and maintain their health by restoring function to the body. Now, I'm going to be seeing you in just a few days, but I wanted to uncover the truth of 3 very common diabetic myths. Okay, so myth number 1 is that a pancreas dysfunction is the primary cause of the disease. Now, it is very rare that a type 2 diabetic has a pancreas dysfunction, believe it or not. There are a lot of other components that are involved, a lot of other organ systems that are involved with blood sugar control beyond just the pancreas. Okay, myth number 2 is that the body needs more insulin. Okay, a very common misconception is that a diabetic is a diabetic and they need insulin to help control the blood sugar. This isn't true. If you're a type 1 diabetic, yes, insulin is the issue. However, for a type 2, it's not the insulin levels that are the main culprit. Basically, more likely than not, you've got more enough insulin that your body needs. Okay, myth number 3 is that the weight gain caused the diabetes. Right, this is another very common myth, that a lot of diabetics think that they have diabetes because they gained weight. Now, most diabetics actually gained weight because they had diabetes in the first place and they didn't even know it. Okay, so again, there's more to it. There's a lot of different causes of diabetes, and when we meet again, I'm going to be discussing diabetes from a completely different perspective than you've ever heard it discussed before. We're going to be discussing all of the different causes of diabetes and so much more. Now, please stay tuned for some words from past and current patients of mine who wish to share their experiences with you.
Life before this program was horrible for me. Life was hardly worth living. I hurt all over. I had no energy. I had nothing to live for in that I have grandchildren. I couldn't play with them. I really didn't want to live very much. My doctor told me I was headed for amputation or organ damage and failure, and it just was so depressing. I was watching TV and I heard about this treatment, and for some reason I was inspired to call the telephone number because nothing else had worked. For my first visit, I met Dr. Carter and all the staff. Everyone was so friendly, so very encouraging. Right away, I knew I could do this. I could do it. It's been just one big success story after another. Every week, I was gaining more confidence. I was gaining more strength, more energy. I was happy. I was so happy for the first time in years. I was truly joyful. I really am successful now. I've lost 22 pounds. I walk like a real person. I love life. I play with my grandchildren. I go everywhere. I'm active in my church. I'm active in the community. I'm happy at home. And it's just a whole new existence. I have gone from the 40, 35 units of insulin to absolutely nothing on most days. I have to gauge it by what my sugar readings are. And even then, it's like 15 units I'll take. But today I took none. Yesterday I took 0. It's just so good. I was taking 3 pills a day. Now I take 1. And pretty soon that'll be gone too. I have a new life. I don't have to worry about getting organ transplants or organ failure or amputations. My sugars are absolutely fantastic, from 370 to 88, 92, 103. If you're there, sitting at home watching me, and you've been through some of the things that I have been through that I've told you, with depression and with no hope, with high insulin intake and pills galore, and your life is just going down the drain like mine was, then I know that this program is for you. At 68 years of age, I am ready to rock and roll. I love my life.
I was first diagnosed in June of 2003. Prior to that, for several months, my doctors had been saying, your sugar's getting high, your sugar's getting high, but they never really did anything about it. Finally, my doctor came in and he said, Bruce, you're a very lucky young man. He said, you don't know how close to death you were. He said, your sugar was over 800. And he says, I've never seen it that high. But I was in intensive care for 5 days, hooked up to everything. And basically, they told me that my pancreas had completely shut down from making any type of insulin. And my potassium level was sky high. So it was a very dangerous situation, and I felt very lucky to still be alive. And after about 10 days of being in the hospital, they did get my blood sugar regulated again, and I was on insulin for over a year, 4 times a day, and went to oral medication and was on that for close to 6 years. And throughout the years, my blood sugars kept getting higher and lower and higher and lower, just bouncing back and forth, and started putting the weight on and felt lousy all the time. And my doctor just kept increasing the medication, you know, no real reason why I had diabetes or how to get rid of it. Prior to being a diabetic, I was a very high energetic person, and I used to rollerblade frequently, ride my bike for many, many miles, several times a week, walk the dogs, swim, run on the beach. But as the disease progressed, my energy level really decreased as well, and I just didn't have the energy to do all that. And it was depressing. Going to different doctors over the years and being prescribed more medications and not really defining what was causing my diabetes was extremely frustrating. Happily was accepted as one of Dr. Ott's patients and began the program in August of 2010. It was fun. It was interesting to see the changes that my body was going through. And after just a couple of weeks, the weight started dropping off. And that was more exciting than anything, because I really wanted to drop about 40 pounds. And I'm almost there, but not quite. It's right around 30 right now. I've been on the program now for 4 months, and I'm very happy to say I'm no longer considered diabetic. I'm completely off all my medications, all my diabetes medications, high blood pressure, cholesterol. My energy level is 10 times what it used to be. I no longer have that afternoon sluggishness feeling after eating. I have lots of energy, and have 2 brand new puppies that love going for walks, and I couldn't do that before. So life is good again, and it's looking better every day.